Hi everyone, thank you so much for coming. We're really excited to share this information with you. Don't worry if you find it a bit challenging at first. After 15 years of alternative research, it was certainly challenging for us. And this is because we were brought up with certain universal beliefs. And we'll be showing you scientific facts that mean they are not necessarily so. Now, this information we're sharing is just the tip of the iceberg. There's so much more GNM information to explore, but today we'll hopefully give you a good introduction to it and start you on your journey, changing your way of thinking about your health and disease in general. We will also be offering tips for integrating this new perspective into your life and point you towards resources so you can take it further if you wish. So first off, I need to draw your attention to the disclaimer. So this presentation is for educational purposes only. It is not intended to be a substitute for professional medical advice. For those who do not know us, I am Lloyd, my wife Danielle. We run a natural health shop. Danielle is also an author and therapist. We first discovered GNM in late 2018 as part of Danielle's health journey. We were quite resistant to the information at first, but we continued to study it because we felt like it was resonating with us on such a very deep level. We then attended an international training conference in Austria in 2019, and since then we've been very keen to share this to others so more people can benefit from having this awareness. We will be mainly reading from notes, as you can see, but this is mainly to keep us on track, as it's such a vast subject and it is way too easy to go off on a tangent. And before we begin, I want to make you aware that the Science of GNM explains the nature and purpose of what we commonly call diseases. We can also experience symptoms through poison, an injury, or malnutrition. But today we are focusing on the nature of disease. Okay, so first we'll take a look at what disease actually is, and we begin with symptoms. Any symptoms, it doesn't really matter at this point. So let's look at the approach of conventional medicine. When we have symptoms, we typically think, I have something wrong with me. And so we usually visit our doctor and are diagnosed with a disease. And if we are given a reason why this disease has developed, it is usually one of rogue cells, bad luck. It's not something we have any control over. It might be bad genetics, hormones, germs or pathogens causing an infection. And the aim is to stop or suppress the symptoms, as they would mainly do this using medication and in some instances surgery. So now we can have a look at the alternative perspective. And this is the perspective of those who do their own research and are maybe into natural and holistic therapies. When we previously had symptoms, we would still think, I have something wrong with me, but we would focus on what might be causing these symptoms and then aim to prevent them. The things that may come up are chemicals and toxins. These could be in anything from artificial ingredients in foods to cosmetics, but also in medications. And this includes some ingredients found in vaccines and dental work, for example. Radiation, diet, nutritional imbalances, and stress is another one, and that's even been recognized in mainstream more recently. But with the alternative approach, we do feel we have some control over our health. So the alternative approach is prevention is better than cure. And so this means avoidance of these supposed causes along with natural products and nutrition, and focus upon building the immunity so we are able to fend off all these diseases that are trying to kill us. So we're going to draw a line across now, because all of these have three things in common. They're all based on the feeling that we have to fight for our health and kill anything that threatens it. They are based on the premise that our bodies are malfunctioning when we have symptoms. And this can give us the effect of keeping us in survival mode and basically locking us into fear. Because everything here is fear-based. The causes are all to be feared and avoided at all costs. The bad luck is to be feared, as we never know when we might be unlucky. And when we are fearful, this itself is putting us under additional stress. So now we can share with you this new perspective, the perspective of German New Medicine, or GNM as it's also known. It is new in the sense that the science has been suppressed for so long that it is now an entirely new concept for us, and not new in the sense it's actually a new concept. So, from the GNM perspective, when we have symptoms, our body is healing. We're not malfunctioning, we are healing. It's a natural process that happens all the time, most often without us even knowing about it. And this natural process is meaningful, as we will explain later. And the approach of GNM is not suppression or even prevention, but as we are healing, we need to support the process. And this approach is also to do with having a true understanding and appreciation of what is happening in our bodies. And this gives us wisdom, a trust in our bodies, innate wisdom. And with this, we are able to let go of the fear and become truly empowered. I don't even mean empowered through fear, by avoiding the causes, but truly empowered by wisdom. And these combined give us peace. When you think of it, if the conventional and even the alternative notions of disease were actually true, how did these people on the left get cancer, and yet these ones on the right don't? And how did Danielle get a large lump in her breast when we had been leading a very healthy, cancer-free, holistic lifestyle for many years, avoiding most, if not all, of the risk factors? It was when we discovered the lump a few years ago that we realized that despite having apparently empowered ourselves with this healthy lifestyle, we were actually still very much afraid. So here's a lovely quote which sums up GNM beautifully, and I'll read it out in a moment, but just to show you, this quote is by Caroline Marcolin, who is a GNM teacher in Austria. She studied directly with Dr. Hammer, who discovered it, and ran the international conference that we attended. So I'll read it out. German New Medicine is not only a new paradigm of medicine, it is also a new consciousness. It is the awareness that our organism possesses an inexhaustible creativity and remarkable self-healing capabilities. It is the recognition that each cell of our body is endowed with the biological wisdom we share with all living beings. For generations, the medical authorities have enslaved and imprisoned the human mind with the fear of diseases. The knowledge of the 5 biological laws allows us to reconnect with nature and regain our trust in her creative and intelligent force. Thanks to Dr. Hammer's unfailing integrity and his dedicated research over the past 3 decades, we can now become free of that fear. So let's take a brief look at the history of GNM. So as I previously stated, GNM was discovered by Dr. Reich Gerd Hammer. He was a German medical doctor who worked with cancer patients. In 1978, a couple of months after suddenly losing his son Dirk in a shooting accident, he developed testicular cancer. And as he was generally very healthy, he wondered whether his cancer could be related to the loss of his son, and so he set about his research. He discovered all his cancer patients had some form of shock or trauma before their diagnosis, without exception, and went on to study over 40,000 cases taking the innovative approach of obtaining brain scans for each patient to see what was going on at brain level. And what he discovered was revolutionary. In 1981, he put together what he termed as the 5 biological laws. These laws define that certain traumas affect certain areas in the brain and that certain organs are governed by these areas, which he called control centers. And the brain controlled specific parts of our organs that were formed at the same time as that part of the brain. We will explain this in a lot more detail further along. Rather than his revolutionary discoveries being celebrated, to his amazement, he received much resistance and persecution from the authorities, the media, and the medical industry. He had his medical license revoked and attended 2 court cases which ended in his imprisonment, and he had to live his later years in exile. Sadly, he died in 2017 of a stroke before a curriculum for official training was established, and this knowledge continues to be suppressed to this day, particularly by continued ad hominem attacks and persecution of Dr. Hammer. And before I go any further, it's important to understand a few things, especially about traditional research compared with Dr. Hammer's research. So here is the definition of the word hypothesis. A hypothesis is an idea which is suggested as a possible explanation for a particular situation or condition, but which has not been proved to be correct. Dr. Hammer's research contains no hypothesis. All his findings had to be without exception, or the theory would be discarded. Unlike conventional medicine, medical science, and to explain this, here's a quote by Dr. Hammer himself. Conventional medicine has 5,000 hypotheses. It is therefore not a natural science. It cannot be. On the other hand, German new medicine is a strict science that has only 5 biological laws of nature and no hypotheses. For the first time in medical history, there is a scientific medicine, which all physicians have always wanted, with which one can now reproduce any patient case strictly scientifically. You would think that the medical establishment and universities would be interested in this discovery, but as I have said, he found it was quite the opposite. Another important note to realize is Dr. Hammer's impressive success rate. In one of the court cases in 1997, the prosecution stated that 500 of his patients had died as part of their case against him. However, the defense were then forced to admit that these next 3 points. These 500 were out of 6,500 patients. Out of the 6,000 who survived, 100% of those made a full recovery. And most of these patients were classed as terminally ill. So this means he had a success rate of over 92%. And in patients who had not undergone invasive conventional treatment, Dr. Hammer claimed his success rate was more like 98%. That's more than anything we have ever come across, and was one of the facts that made us take notice and work through the challenge of unlearning everything we thought we knew. So I'm going to hand over to Danielle now, who will take you through the 5 biological laws.
Hi everyone. It's really great to be here in such lovely surroundings as well. We've been so looking forward to this event, and we're really pleased it could go ahead, even though all our others had to be cancelled. And I'm really grateful to be in a position to be able to share this information as well, because understanding GNM really has changed our lives for the better. We have literally not been able to keep this information to ourselves ever since we learnt about it, because we know how much it can help enrich other people's lives. We now live with much less fear than before, with greater appreciation of ourselves and with so much gratitude for our amazing bodies, and increased awareness of the wonder of nature all around us. This is all thanks to GNM. After Lloyd's introduction, you may already realize that things are not what they seem and not how we've been taught. And this is summed up in the great quote by Albert Einstein. The only thing that interferes with my learning is my education. So with this in mind, I will give you a little advice which I wish I'd had at the start. Just for the next few hours, forget everything you think you know, and just listen with an open mind. If you try to hang on to beliefs or knowledge, you can create resistance, which can make it more challenging and confusing. And this I found out myself. You see, when you learn GNM, you are not only learning a lot of new scientific information, you are also experiencing a huge shift in your awareness. Once I let everything go, it was so much easier. And once I had GNM as a foundation, I could then revisit my previous beliefs and therapies and education with this new perspective and realize what was still relevant. So I'm going to present a basic overview of the 5 biological laws of nature, which are the foundation on which it is all built. Some things will be built on and understood more as we go along, particularly in the case studies where it will all start to come together. So let's begin with the first law. And the first law is the iron rule of cancer, and it states that every disease is a biological special program which is set off by an unexpected, highly acute and isolating conflict shock that occurs simultaneously in the psyche, the brain, and on the corresponding organ. The 3 components of this law that are highlighted are the 3 criteria of the first law. And I'll look at these now in a little more detail. We'll start with the conflict shock. So Dr. Harmer called the conflict shock a DHS, and that stands for Dirk-Harmer syndrome. He named it after his son Dirk, as it was his death that started the research. A DHS is a moment of shock when something unexpected happens for which you are unprepared. It is highly acute and gives a feeling of isolation even if there are people around you. And time may even feel like it's standing still. And there may be thoughts such as, nothing will ever be the same. You may experience also things like tingling all over and feel like you're in a dream. Some examples of situations that cause a DHS are listed here. I won't go through all of them, but you've got things like losing your home, an unexpected pregnancy, news you can't accept, being bullied, feeling unheard, having an operational procedure, a divorce, an accident. So basically anything can cause us a DHS if our perception of it causes us trauma. So the next thing about a DHS is it's highly subjective. That is, it is dependent on our own perception of the situation. It is controlled in the subconscious, and therefore it reflects our innermost beliefs. For example, a divorce can affect someone as an abandonment, if they're thinking I've been abandoned. A separation, my home is split or broken. Starvation conflict, who will provide for me? A loss conflict, I'm losing my partner. An indigestible morsel conflict, I cannot digest this news. A self-devaluation, there's something wrong with me. Or an identity conflict, I will no longer be a wife, who am I? That's just a few examples. So the DHS can be figurative or literal in humans. In nature, it is simpler, but we are complex emotional beings. So an example is what is known as a morsel conflict. A morsel is basically something. An indigestible morsel affects the GI tract. In an animal such as a dog, the morsel could be a piece of bone that it can't digest. In a human, it could also be news or a situation that we can't digest. But the important thing to understand is that the DHS is something that is shocking and catches you off guard. We have minor ones all the time, but for something that triggers a more serious condition, such as cancer, it is something that really hits you. So going back to the divorce, if the marriage had been breaking down for a while, even though this could be deeply upsetting and emotionally traumatic, they would be less likely to be an actual DHS. But if one day out of the blue the partner comes home and says, "Hey, I want a divorce," then they would be more likely to be a DHS. So let's move on. And the law states that the conflict impacts the correlating brain relay and instantly communicates to the corresponding organ, setting into motion the biological special program. A biological program is basically a survival mechanism, and some of these programs have no modern-day benefit, but they're left over from our development as an embryo and the evolution of life on the planet, showing us how connected we are to all living things. Basically, the brain takes action to make biological changes to allow us to better cope with the trauma. For example, it will enhance the function of an organ or widen a duct to allow for more bodily fluids to get through, or it could prevent movement, so in the face of danger, we in effect play dead. So to explain in real terms, we'll take a lung cancer case as an example. This is triggered by a death-fright conflict. So when the body feels like its life is threatened, its survival mechanism would be to take in more oxygen, so as it prevents death. So the program causes cell proliferation to increase the surface area of the lung temporarily to enable us to absorb more oxygen. But the science goes even further than that. And Dr. Harmer found that, depending upon which part of the brain the organ relay is in, the site of the symptom is determined by factors such as laterality or biological handedness, which I'll come back to in a moment, hormone status, whether the person is male or female, whether the morsel is incoming or outgoing, or the association with a person or an item. So let's look at biological handedness for a second. And this is really important in GNM, as you'll find out. Your biological handedness is not necessarily how you write, because a lot of left-handed people are actually just taught to write with their right hand. So a good way to determine your biological handedness is to clap your hands. So if everyone wants to just clap their hands, okay, so the hand that's on the top or the most dominant would be your handedness. There's other ways to find out if that wasn't clear, but that's usually the easiest. So in GNM, for right-handed people, their left side would be their mother, child, maternal or nest-related side, and their right is partner, sibling, colleague, or anything else related. And the left-handed are the opposite. This is because, as a mother, we nurse children with our non-dominant side, so our dominant hand is free. So we subconsciously associate the non-dominant side as our maternal nurturing side. And you'll understand this more as we go along. So the third aspect of this law is the connection between the psyche, brain, and organ. And Dr. Harmer stated, the differentiation between the psyche, the brain, and the body is purely academic. In reality, they are one. What Dr. Harmer found was that the biological program and healing took place simultaneously in the brain and organ. This suggests that rather than having communication between them, they are, in fact, one. Modern science has conditioned us to look further into something in order to understand it. But more and more we are realizing that this only looks at part of the picture. And really what we need to do is step back to understand the bigger picture. It's a bit like looking at a computer component and trying to work out what's making the letters appear on the screen. If we step back, we can see the person typing the keyboard. So getting back to the brain, Dr. Harmer found concentric circles on each scan where there was an active conflict, and these were later termed as a Harmer focus. So he found that the Harmer focus appeared in the same location in all patients experiencing the same conflict shock. He found that patients presenting with the same symptoms or conditions showed activity in the same area of the brain. And healing took place in the brain and organs simultaneously, as I've already said, correlating what happened on the organ level and the conflict shock experienced. The survival program that is triggered followed evolutionary logic. So for a moment, let's try something. Close your eyes and just imagine in front of you a nice, fresh, juicy lemon cut in half. See the colours and the juice drip from the flesh. Now take the lemon and bring it to your mouth to take a bite. Feel the bitterness and the juice in your mouth. So, who didn't salivate then? I did just reading it. So this just shows how our thoughts or psyche control our bodily functions. We will look at the control centers in more detail after I have introduced you to the third biological law, as the information in the third law is relevant to them. But for now, here is an example of some common conditions, from serious conditions to minor ones, along with their associated conflicts. And I'll just read a few out. So we have arthritis and rheumatism there, self-devaluation conflict. We have glandular breast cancer over there, nest worry. Colon cancer down the bottom, indigestible morsel, which we've suggested. Kidney disease or kidney cancer, abandonment conflict. And we've even got at the top nappy rash, separation conflict. And a cold, a scent or stink conflict. So Dr. Harmer found associated conflicts for all diseases and conditions. And these are detailed on a great reference website called learninggnm.com, which has an index of symptoms and conditions, along with detailed information of the related conflict and biological programs. So now we'll move on to the second law. So the second biological law states the two-phase nature of all biological special programs. As long as the conflict is resolved, the body will heal and return to normal. So this is the official GNM compass that shows the pattern of a biological program on a timeline. So here we have time running from left to right. The top of the line is the stress phase, when our sympathetic nervous system is dominant. And here we are alert to what is happening around us and reactive to it. This in GNM is called sympaticatonia. Underneath the line then is the non-stress phase, where our parasympathetic nervous system is dominant. This is our parasympathetic nervous system is what controls our bodily functions and things that go on in the background. And this in GNM is called vagatonia. So the central horizontal line is like a timeline. We have the normal circadian rhythm then at the start here and at the end. And this in GNM is called normotonia. When there is a conflict shock, the body goes into a conflict active stage, a prolonged stress phase, where there are very little symptoms. When there is a conflict resolution, the body enters a healing phase in a prolonged non-stress state, where it is basically getting back to normal. This is in two parts, with a temporary stress in the middle, called the epileptoid crisis, or epicrisis for short. So we have the DHS there as the official name for the conflict shock. we have CL for conflictolysis, which is the conflict resolution. And then we have PCL, which is post-conflictolysis. And we have PCLA, PCLB, which are the two phases of healing. So we're going to look at each phase in a little more detail, listing some typical symptoms that you may find in each. These symptoms are all a general collective of typical symptoms, but what is actually experienced will depend on which biological program is running. So this just gives you a sense of each phase. So first we have the conflict active phase. Even though there are very few physical symptoms, there are some signs of conflict activity, and these are cold hands, stress, inability to focus on anything but the conflict, sleeplessness, and a weak appetite. These are all purposeful to facilitate a speedy conflict resolution. We do not want to be using up time and energy with bodily functions, such as digestion. And as we are driving ourselves to solve our conflict, we don't want to waste time sleeping. We need to be thinking about the problem all the time so we can work out a solution. In this phase, early detection methods may detect a lump or shadow, depending on the program that you're in. So if we relate this to a colon cancer case, which is triggered by an indigestible morsel, the survival mechanism would be to increase the surface area in order to help digest the morsel. So when the conflict is active, we will see cell proliferation. The growing cells are different to those of the colon, and diagnosis at this time would be an aggressive colon cancer, as it is in the growth phase, and it would normally only be picked up from a routine examination or early detection screening, as there are no symptoms. So let's look at the healing phase. First at healing phase A. So typical symptoms would be inflammation, such as swelling and bloating. Inflammation is purposeful, as it provides protection for the cells while they're healing, and it facilitates healing as cells require a fluid environment in which to heal effectively. And of course, then you may also see pain, discomfort, and itchiness along with the inflammation. Fatigue, and it is a very common belief that we heal best when we are asleep, and that is true. It's because our body needs all of the energy for healing. We may see night sweats and general fever in this stage, and we may see some discharge, though this is primarily in phase B, so I'll come back to that in phase B. So in our colon cancer case, there would be pain and inflammation, and here we will see microbial activity, such as TB bacteria and Candida fungus, which are activated by the brain to break down and dispose of the additional cells. We'll look at that more in a moment, but I mention it here as it explains why the additional cells are different. Because they need to be easily identified by the bacteria and fungus in order for them to break them down and remove them. At brain level, we will see the small lesion caused by the DHS surrounded by inflammation to protect it. When the reconstruction or deconstruction work of the cells is almost completed, and we need to eliminate the waste that has been produced, our body goes temporarily back into the stress phase, which gives the body the energy to push out the inflammation and waste. Epicrisis usually occurs in the early hours of the morning or at times of rest, such as weekends or even holidays, due to the optimum state of non-stress we are in at these times. On the brain level, the inflammation is also released. So here we will see the following symptoms: headaches, dizziness and fainting, maybe seizures and spasms, increased stress, anxiety, panic of the original conflict may come back, bursting blisters or boils, shivers, cold fevers, coughing fit or asthma attack, nausea, vomiting, and increased urination. So referring to our colon cancer case, in addition to headaches, shivers, and other epicrisis symptoms, we will see stomach cramps and elimination, which includes diarrhea with mucus and blood. In the second part of healing, phase B, we will mainly see a lot of evacuation. In particular, there is lots of urination as the inflammation is released. There will be elimination of other waste too, such as pus, mucus, diarrhea, and any of this may contain blood. There will be fatigue and tiredness as our body continues to recover, and we may still have some pain, itchiness, and fever, though as epicrisis is a turning point, this will now be greatly improving. Phase B is primarily our recovery. On brain level, we see glia cells surround the lesion to repair it and bring it back to normal. So this is how every disease will play out. There can be complications though. So the first complication we'll look at is a hanging conflict. A hanging conflict refers to the situation where a person remains in the conflict active phase because the conflict cannot or has not yet been resolved. So the severity of the healing phase is determined by the length of the conflict active phase and the intensity of the DHS. And this is why the symptoms of the conflict active phase serve to facilitate a resolution as quickly as possible, so we can have an easier healing phase. So with a hanging conflict, if something has been unresolved for quite some time, we need to be careful, as a complete resolution may cause an intense healing phase and epicrisis. So next we have a hanging healing, which refers to the situation where the healing phase cannot be completed because of continuous conflict relapses. So that's indicated as RE. So if you look, you've got your conflict active phase, then you have your resolution, we go into healing, then we have a relapse. We go back into conflict active phase, then we get a resolution and we have the healing, and it continues in a loop. This could be from a recurrence of the conflict, so the same thing happening again, although we may not experience it so severe the second time because we've kind of been there before, or it could be caused by a track. So when we experience the DHS, we purposefully enter a highly receptive phase. The biological purpose for this is so we can create a warning sign for the future, so if this conflict was ever going to happen again, it will be prepared. This is why we kind of go into a dreamlike state, and time can appear as if it's standing still, as an increased perception has this effect. We create a warning sign by making a subconscious association between the conflict and whatever is being perceived at the time. And this is what is known as a track. But we may call it a trigger or even an allergy. And this, according to GNM, is what an allergy actually is. The track could be anything from a food, a substance, even a color, a place, or a person. So, for example, if I was looking at you now and I had a phone call which caused me to have a DHS, I may end up allergic to you. So what that means is every time I saw you, my subconscious would trigger the program in preparation for the DHS. Another complication is the syndrome, which is an existence, hospitalization, isolation, or abandonment conflict experienced in the kidney collecting tubules. This is basically experienced as feeling like a fish out of water. The evolutionary logic stems from when early life was water-based, and being out of the water threatened survival. This increases inflammation in evolutionary terms to prevent the living being from drying out. And this inflammation is centered around areas where a biological program is running at both organ and brain level. It can really worsen symptoms and conditions, which is why people tend to go downhill when they are put into hospital or put into a nursing home. It can occur in any phase, but you will mostly find it in healing, as this is when we are having symptoms and are therefore more likely to be hospitalized or feel our existence is threatened. It can also be a conflict in itself, and an active abandonment conflict is a cause of obesity according to GNM. This may also explain obese people appear to suffer worse symptoms than those who are normal weight. Care needs to be taken as it can cause serious problems at brain level due to the increased inflammation around the brain lesion. So we'll move on and look at the third biological law, which is the ontogenetic system of biological special programs. Ontogenetic means the origin and development. So Dr. Harmer found the following, that in line with embryology, the control relays of our organs are found in the part of the brain that developed at the same time as the organ. That all organs controlled from the same part of the brain will run the same biological program. In embryology, there are three germ layers, the endoderm, the mesoderm, and the ectoderm. A germ layer is layers of cells that developed at the same time in the embryo. Dr. Harmer found that parts of the brain that developed at the same time as a particular germ layer controlled the cells in that germ layer. However, some mesodermal organs were controlled by the cerebellum, which ran biological programs the same as the brainstem, and some were controlled by the cerebral medulla, and these ran the same biological programs as the cerebral cortex. So he split the mesoderm layer into two. As the brainstem and cerebellum are regarded as the old brain, and the cerebral medulla and cerebral cortex are known as the new brain, he named the two mesoderm layers old mesoderm and new mesoderm. So the first germ layer to develop is called the endoderm. And here we have the alimentary canal and the brainstem. So all endodermal cells in the body are controlled by the brainstem. The function of these are the most basic needs of life, and that is for food, breathing, and procreation. The old mesoderm layer, which includes our corium skin, endoskin, and protective layers of bones and some organs, and these are controlled by the cerebellum, with the function of protection. The next germ layer is the new mesoderm, which is mainly our bones, muscles, and most of our structure, controlled by the cerebral medulla, which is part of the white matter of the brain, and the function is for stability and movement. The ectoderm, which is our outer skin and duct linings, controlled by the cerebral cortex, are areas of our body that are concerned with separation to and interaction with the outside world. The colours used for these germ layers are used as standard throughout GNM, so you can see exactly which germ layer is involved and therefore which type of biological program is relevant. So now we can revisit the psyche-brain relation as described in the first law and look at the control centres in more detail, as the colouring and information regarding the germ layers will now make more sense, I hope. So the brainstem is the oldest part of the brain, and it is the only part of the brain that does not correlate with the biological handedness rule, as it literally developed before we had a right and left side. As the function theme of this layer is our basic functions for life, the conflicts that affect this layer are those that threaten this, such as incoming and outgoing morsel conflicts, procreation conflicts, and breathing conflicts. The biological purpose of the program here is to facilitate the basic function of the body parts, such as increasing the surface area of the organ for better absorption of the morsel or secretion of juices to digest the morsel, for example. So here we find the organs of the alimentary canal moving all around in order, in a circular motion, perfectly mirroring the archaic ring of early development. So we got starting at the bottom right here. We have organs and body parts concerned with things that we're bringing in, incoming muscles. Then we have digestion. And as we come round, then we have the colon and the rectum. So we're moving towards the body parts that deal with elimination. So if we draw a line down the center, I don't know if you can see that dotted line down the center, in the paired organs, which you find on both sides, there would be incoming morsels on the right and outgoing morsels on the left. So for example, a shock from not being able to hear something would affect the right middle ear, which is, in GNM terms, is unable to catch an incoming sound morsel. And a shock from an unwanted sound is being unable to eliminate a sound morsel, which would affect the left middle ear. The cerebellum controls these parts of the body, and so we have the breast glands, the pleura, peritoneum, corium skin, pericardium. And from now on, the biological handedness rule applies. Most of the cells in this germ layer are concerned with protection, and therefore the general conflict theme is an attack conflict, or a type of attack, which includes feeling soiled, so protecting yourself from dirt. So the biological purpose of the programs run from the cerebellum is to increase the cells temporarily for increased protection. And we'll take an example. So we have here the pleura relay, and as it protects the lungs, the conflict would therefore be an attack or a perceived attack to the lungs. The location would be either mother-child related or partner anyone else related, depending if the person is right or left-handed, but it could also be localized. So if the attack was physical, the program would run at the site of the attack. This could be surgery, a biopsy, or any medical procedure, as well as being physically attacked. We can also experience a figurative attack, and this could be sharp stabbing words, insults, finger pointing or accusations, or being told that your lungs aren't working properly, or even the fear that you have been exposed to something deemed harmful. For example, hearing that smoking causes lung cancer after you've smoked for years could actually literally trigger a DHS. So here are the body parts controlled from the cerebral medulla. And this almost looks like the small structure of a human. The majority of these body parts are concerned with structure and movement and are affected by self-devaluation conflicts, which is related to the function of the parts themselves or to ourselves as a whole, with thoughts of, I am not good enough. In other words, it can be caused when we continually mentally blame ourselves or certain body parts for things that we cannot do or things that happen to us. So, for example, you may have an injury and it causes pain, and then you feel, I can't do my favorite thing anymore, so you start to devalue it. Or you might think, my stupid back, every time you get up and it hurts. My legs are not what they used to be. These are all statements of self-devaluation. A hanging healing is then created every time you move but hurt that area and think these thoughts, or are triggered by a track that caused the original conflict or injury. We can even cause further self-devaluation conflicts such as, I am getting old, I'll never be able to do this again. This increases inflammation and worsens the condition, often causing a chronic condition such as arthritis, and even conditions like fibromyalgia, when we self-devalue ourselves as a whole. With the increasing trend of low self-esteem and self-belief, it is easy to see why there is such an increasing number of people suffering from these conditions. We also have the ovaries and testes in this, which are linked to a loss conflict, where it's a type of self-devaluation where there is an element of self-blame to the loss. The biological purpose of the programs in this germ layer are to break down the tissue and then rebuild it so it's stronger than before. So now we'll move on to the cerebral cortex. This is a very complex brain layer, so I'll just touch on it briefly. So here we have the presensory, sensory, post-sensory, motor and visual cortex, and the glucose center is in the center, and the red areas of the temporal lobe around the edge. The main conflict themes of this brain layer are the more complex conflicts of separation, sexual, and territorial conflicts, and therefore how we relate to the outside world. And the biological purpose of the programs in this layer is to facilitate a conflict resolution. The temporal lobe conflicts are divided into male and female conflicts, and how they are experienced is determined not only by biological handedness, but also by hormone status and gender, and whether other conflicts are active or healing in this part of the brain. So I'll leave that here for a moment, but we are going to come back to it a bit later. So if we add the brain centers and the germ layers to our compass, you can see that the biological programs controlled by the old brain, which is the brain stem and cerebellum, they all have cell proliferation and conflict activities, with cell removal with fungi and bacteria in the healing phase. And the new brain, which is the cerebral cortex and the cerebral medulla, they have cell loss with ulceration or necrosis in the conflict active phase, followed by tissue restoration with bacteria in the healing phase. As the cell growth during the healing phase of new brain programs is essentially a replenishing process, replenishing lost tissue, tumors in these programs could actually be termed as curative tumors. And I haven't yet given an example of this, so I will now. We'll look at an introductal breast cancer, which is triggered by a separation loss conflict. And this is experienced as, my child has been torn from my breast. The purpose of the cell loss is to widen the ducts so the milk that is no longer required can leave the breast quickly before it calcifies. The healing phase will see reconstruction of the cell loss with cell proliferation, along with inflammation and pain. Once the reconstruction is complete, the inflammation and waste is pushed out of the body, sometimes via the skin or nipples. Traces of milk may be left behind and calcify, and this is commonly diagnosed as ductal carcinoma in situ.
So the temporal lobe is a part of the cerebral cortex, and the control centers are these red areas. The left side is concerning female conflicts and governs estrogen, and the right side is concerning male conflicts and governs testosterone. So here are some related conflicts and brain relays or control centers. So the right is as you'd expect for the male area, and that's all to do with territorial. And the left is the female conflicts. So these are sexual identity and scare fright type conflicts. Ordinarily, a man will only suffer male conflicts and a female will only suffer female conflicts. So, for example, it is a lot more likely for a man to have a heart attack involving the coronary arteries than a woman, as the coronary arteries are controlled from the male right side. And to quote Harvard Medical School, throughout life, heart attacks are twice as common in men as in women. In someone who is left-handed, the opposite control center is impacted by the conflict. So a left-handed man experiencing a territorial anger conflict, we get piles instead of gallstones, for example, because it's opposite the bile ducts, you see, so it experiences in the opposite side. A changed hormone status means either someone who is on hormonal drugs, such as hormone replacement therapy, birth control drugs, etc., during pregnancy or breastfeeding, post-menopause, or on a male, it might just be past a certain age when testosterone levels drop naturally. In these cases, men can then experience female conflicts and women experience male conflicts. So they're basically reverses. The further complications are left-handed as well as changed hormone status, or if there is already a conflict that is active or healing in the temporal lobe when a new conflict impacts. So we won't go into all the variables. I'm sure you'll appreciate that'll be quite confusing at this stage. However, the beauty is that even if you do find this confusing, which many do, the Learning GNM website we mentioned sets it all out for you clearly in the relevant biological program pages.
So we'll look at the fourth biological law now, and this is the beneficial role of microbes. And what Dr. Harmer found is that microbes exist within us in a dormant state. During biological programs, they are activated by the brain to do a certain job. This is already being widely accepted in modern science with evidence of the microbiome. So Dr. Hammer found that in the healing phase, bacteria such as TB, Staphylococcus, streptococcal, and fungi such as Candida assist in the breaking down or replenishing of tissue. He found so-called infectious diseases occur exclusively in the second phase of a biological special program, where the organism uses the microbes to optimize healing. Microbes need an acidic environment in which to thrive, carry out their work. White blood cells assist in healing and is why they are present at the site of infection. So understanding this helps us to realize some incorrect assumptions that are made by those looking from the old perspective, such as when the acidic environment is found at a healing site, it's assumed that this is a contributing factor to disease, but it isn't. In fact, alkalizing at this time would inhibit healing, despite it generally being considered a healthy practice. And at a wound area of healing, you will find bacteria or fungus. It is automatically assumed that the bacteria or fungus is causing the disease by infection. This is shown in some research where it is claimed that cancer is a fungus. You will also find inflammation, and it is automatically assumed that this is also a contributing factor. When we find white blood cells, it is assumed that they are fighting the infection, but actually they are not. They are supporting the healing process of the tissue. And I heard a great analogy of this concept from another GNM teacher who said it is like fire trucks saying that fire trucks cause fires as they're always present when there is a fire. So you see these assumptions are made as modern and most alternative medicine is immersed in the hypothesis that disease is a malfunction and that most microbes are our enemy. So when experiments are carried out, they are viewed and interpreted incorrectly. Often the end results may be similar, but the interpretation is different. And in addition, most research is based upon removing the cells from the body and observing the behavior in something like a Petri dish. But it does not take into account the psyche-brain organ correlation that Dr. Harmer found and is stated in the first biological law. And therefore, this works on the hypothesis that cells function the same in a Petri dish as they would inside the body. So what we understand is not necessarily true. So with this knowledge, we understand that our immune system is not really an immune system at all, as the very term immunity implies that we need to fight microbes and disease. But now we understand that this is not the case. What Dr. Harmer found is that the components of the immune system supported healing rather than fighting disease, and therefore he termed it as a support system. We also need to ask the question, if so-called contagious diseases are symptoms that are part of an individual healing of a biological program triggered by a trauma, then can we actually catch another person's healing? The answer is we can't. In understanding GNM, we understand the mind-blowing concept that diseases cannot be contagious. However, our subconscious beliefs can trigger the same DHS due to our beliefs and fear that we can catch it. Or alternatively, we can experience the same situation that causes a similar conflict shock, which will trigger the same program, making it appear as if there's an outbreak. An example of this is like at the end of a war, where there would be the mass resolution of many similar conflicts, such as death fright or territorial fear for many people, causing apparent outbreaks of TB or flu, for example, like the Spanish flu. In addition to this, Dr. Harmer found that the bacteria, fungi, and other microbes also exist in line with embryology and are controlled by the parts of the brain that were developed at the same time, just like the body organs. This is illustrated in the diagram, so again the colours are relevant to the germ layer and part of the brain where they are controlled. They do not cross over into different parts of the body that are controlled by different parts of the brain, as each germ layer is in effect its own complete system. So you would not find fungi in the new brain program, for example, and you would not find certain bacteria such as staph and strep in the endoderm, only mycobacteria like TB. So this means that the hypothesis theory of systemic conditions such as sepsis is incorrect, and this is in fact multiple healings taking place at once. You'll also notice that it says at the top, viruses, if they exist. Dr. Harmer found no evidence that an isolated virus even existed, and this is reflected in later work of others, such as Dr. Stefan Lanka and many other doctors who have come forward recently during this apparent pandemic. There is also a great book called Virus Mania, you may wish to read to explore this further. What Dr. Harmer found is that diseases in the ectoderm that were not assisted by bacteria healed without the assistance of any microbe. So he left this open as he was waiting for the proof of the existence of viruses. And in line with his discoveries, he stated that if viruses existed, then they would assist the healing of the ectodermal germ layer. And here is the fifth biological law, and it is the quintessence of GNM. Quintessence meaning the fifth and highest element. Every so-called disease is part of a biological special program of nature, created to assist an organism, humans and animals alike, during unexpected distress and comprehensible in the context of our evolution. So, what does this mean? I'll just give you a little summary. It means that when we have symptoms, we are actually in healing and not sick. It means that cancer and disease are not random or bad luck, but were previously meaningful for our survival. It means almost everything we understand about medicine, conventional or alternative, is based upon the assumption and hypothesis, and is also based on fear. And here is another big shocker. According to Dr. Harmer's scientific research, cancer cannot spread. Metastasis is a theory based on assumption. What appears to be spreading is actually a new conflict shock or new conflict shocks. These are likely caused by diagnosis shock or negative prognosis, or even a fear of diagnosis. And here are some examples. We have a death-right conflict affecting the lung, self-devaluation conflict affecting the bones or the lymphs, an indigestible morsel conflict affecting the colon, an existence hospitalization conflict causing the syndrome, disfigurement or attack conflict affecting the corium skin. And do you realize what these cancers all have in common? Lung, bone, skin, colon, lymphs. These are the most common types of what are called secondary cancers. And now you know why. Let's just think about metastasis for a moment. Let's say metastasis from the breast to the bone. So the self-devaluation conflict, which happens in the bone, would happen at the area, the closest area to the original conflict. So this would be the ribs or the sternum. Sorry. If we refer back to the compass for a moment, breast glands are controlled by the old brain, the cerebellum, and bone is controlled, the cerebral medulla, which is in the new brain. So the cerebellum program for breast glands would have cell proliferation in the conflict active. The bones would have cell loss in conflict active phase. So if they were the same disease, wouldn't they act the same if one had spread to the other? Well, it's because they're a different or a new program that they act differently. And if it did travel, how did it get there? The blood, maybe? Well, if that's the case, why aren't blood transfusions ever screened for cancer if it can spread via the blood? Why are cancer cells not found in transit in the blood? And why is it that specific cancers have specific secondary cancers? If it was easily spreadable, wouldn't it affect the closest body part it came to, such as the blood vessels or even the heart? Or does it spread via the lymphatic system? Well, the lymphatic system doesn't serve the bones, so that falls down at the first hurdle. Regarding the lymphs, the same rule applies as the bone, in that the new conflict shock would affect the lymphs closest to the original conflict. So the lymph nodes that are closest to the original conflict would have the symptoms, and this makes it appear as if it spread to the lymphs. The lymph is a moderate self-devaluation conflict, whereas the bone is a severe self-devaluation conflict. That's the difference. And that's not all. Considering that Dr. Harmer found that each germ layer is its own system with no crossover between them, we can also see that cancer of the breast cannot spread to the bone or the lymphs because it's not in the same germ layer, it's in a different germ layer. In a nutshell, what does this mean? It means we no longer need to be afraid of disease. For it is the fear of cancer spreading that is the worst fear of all. So we come back to this slide that Lloyd presented at the start, and you can now look at it from this new understanding and realize how GNM really can give us peace and move us away from fear. And here is the quote from A Course in Miracles teacher Marianne Williamson that sums it up beautifully. A miracle is a change in perception from fear to love. My experience of learning and understanding GNM really has moved my perception of health and my body from fear to love. Not only do I no longer feel afraid of symptoms, but it has given me true appreciation and gratitude for my body, encouraging true self-love and acceptance. So one of the criticisms of GNM that you will find if you did some research on it is that people often say it does not offer a therapy. But this is far from the truth. The way we see it is that GNM actually redefines what therapy actually is, as it does not seek to interfere or force results like other therapies do. It does not form a modality upon other concepts, but rather forms a solid foundation upon which to build a treatment protocol that works in harmony with and is supportive to the natural process as much as possible, with intervention only when necessary. Remember, Dr. Harmer achieved his impressive success rate through the application of the 5 biological laws, which in itself proves that GNM does indeed have therapeutic value. Of course, the only thing we do not have access to are the brain scans that Dr. Harmer used as part of his work, as he could say just by looking at the brain scan precisely what the conflict was, who was involved, what biological program was running, and where in the biological program that person was. So without this, we have to be a little bit more investigative with our approach. So here is a summary of the main points of GNM therapy that we have put together. With a firm understanding of the 5 biological laws, you will also understand that it is important not to cherry pick from this, as you will appreciate why each of these points are crucial to adhere to. So, understanding the 5 laws, obviously that removes the fear and resistance. Understanding the conflict and the biological program, and therefore knowing what to expect, again removes the fear. Recognizing and understanding when this is not recommended. Ensuring all treatments are supportive to the biological process. Trusting in your body and the process. Being aware that procedures can cause new conflicts. Avoiding stress and fear and giving love and support to somebody who's going through things. Avoiding digging up old conflicts and emotions so as not to re-trigger conflicts or cause a hanging healing. And understanding when intervention such as surgery may be required. So I'll now hand over to Lloyd, because he can put it together and say some final words and things.
Thank you. So, bring this section to a close now. I'll finish the GNM part of the presentation by leaving you with a few final words that may help this resonate with you. We are doubts and nagging thoughts that will inevitably run through your mind too, because this is such a different way of thinking. Things like, surely this isn't true, that everything we thought we knew was wrong. But when this happens, just remember that all the advice we've received, whether conventional or alternative, is based on the incorrect premise that cancer and disease are malfunctions and are out of control and need intervention. We now need to view them from this new perspective. This is also an important point to consider about the advice we often receive or read. We can go to different doctors or therapists and be given different advice. And this is proof that their training has been based upon hypotheses and assumptions. So there's a lot of room for interpretation and opinion. You will not find this with practitioners at GNM who are practicing GNM true to Dr. Harmer's work, because it is an absolute science with no room for assumptions or perceptions. Looking at your own and family friends' health history, working out the DHSs that's happened in the past, helps give a deeper understanding and helps this to resonate. We found this very useful ourselves. Life is hardwired for survival, growth and procreation. It does not make sense that the body would create a substance, such as cholesterol, house a microbe or allow processes that would destroy it. That would defy natural law and evolutionary logic. And I'm going to finish off with a lovely quote from Dr. Harmer. All so-called diseases have a special biological meaning. While we used to regard Mother Nature as fallible and had the audacity to believe that she constantly made mistakes and caused breakdowns, malignant, senseless, degenerate, cancerous growths, we can now see, as the scales fall from our eyes, that it was our ignorance and pride that were and are the only foolishness in our cosmos. Blinded, we brought upon ourselves this senseless, soulless, and brutal medicine. Full of wonder, we can now understand for the first time that nature is orderly, and that every occurrence in nature is meaningful, even in the framework of the whole. Nothing in nature is meaningless, malignant, or diseased. So that brings this GNM part of our presentation to a beautiful close. So I'll just share some more general information. So this is the show we recorded with Richard. If we go to the Rich Planet website. Many of you have already seen this show, but we think it complements this presentation very well anyway. So it's on the Rich Planet website, and it's the Sacred Medicine Show. For further information on GNM, obviously I'm going to highly recommend your book. Is the culmination of all the research into natural health, toxins, therapies, body, mind and spirit, and so much more. It's now rewritten from the GNM perspective. It's in its 3rd edition. She extensively rewrote it once we discovered GNM. She's done it in such a way that explains the transformation from the old way of thinking into the new paradigm really well. And I think it should help people with the integration of GNM knowledge into their lives. There's also introductory articles on her website as the daniellebryant.co.uk one. And there's a therapy website as well. And she's also on Patreon and YouTube. And the learninggnm.com is the excellent website we highly recommend. It's got the A to Z official tutorials. Caroline's got some videos on there that we mentioned. And Danielle has set up a GNM UK community on Facebook. So if you're not already a member, you're welcome to join that. But look specifically for that. And the image at the top is that sunset you can see in the background, just so you know you've got the right one. And that's the end of that section.